Hi, everyone. Thank you for joining us today over your lunch hour for our town hall on what to expect for COVID-19 vaccination distribution at UW-Madison. I'm Kelly Terrell. I'm the Director of Research Communications here at UW-Madison, and I'll be leading the discussion with our panelists. Just to remind you, you can find links for captioning and sign language in the links listed in the event description below this video. Today, we're going to cover information regarding vaccine distribution and frequently asked questions from employees that were submitted to their HR representatives. This is the first of 2 town halls, so if we don't get to something today, we'll be providing you another opportunity to send in your questions. And we hope the information that we share today will answer most of those. But we want to provide clarity about how the vaccine is being delivered on campus, what to expect once you've been vaccinated, and where you can go for additional information about vaccines. Now I'd like to introduce our panelists. They represent a much larger team of people who have been helping us develop the university's COVID-19 response plan and think through the many details involved with this effort. We have Jake Baggett, who is our Associate Vice Chancellor of Student Affairs and Executive Director of UHS. Jake works with local public health agencies and prevention and clinical providers in UHS to help keep campus healthy. We also have joining us today Dr. Devlin Cole. Dr. Cole is a preventive medicine resident at UHS. Dr. Cole works with UHS and our state partners to help lead COVID-19 vaccine strategy and planning. And we are also very fortunate to be joined today by Dr. Ajay Sethi, who is an associate professor of population health sciences. Dr. Sethi serves on a number of campus-wide COVID-19 planning committees, and he works with UW Hospital and clinics on data projections and research into COVID-19 and other infectious diseases. Just to get us started, I thought I would let you know that UW-Madison had started to vaccinate our campus community on January 5th, 2021. That's when we started receiving vaccines from the state of Wisconsin. And to date, we have been able to provide 9,246 vaccines, which is just really an impressive feat in the last couple of weeks here. This includes both first doses and second doses for the 2-dose vaccines that we've been receiving here on campus. All of our vaccinations are happening at the Nicholas Recreation Center on campus, and we're very thankful to our partners at Recreation and Wellbeing for sharing that space with us. And also because I think it can sometimes be confusing, and I'm a research communications director and a science writer, I just want to clarify that COVID-19 is the disease caused by a virus called SARS-CoV-2. So when we talk about COVID-19, we're actually talking about the disease, and when we mention the virus, we're talking about SARS-CoV-2. As a reminder, our McBurney Disability Resource Center is providing captioning and interpretation via the live links, or the links listed below the video. So without further ado, I want to get into the question that I think most of you have, and that is, when can you, as a UW-Madison employee or a student, expect to get a vaccine? Dr. Cole, what can you tell our listeners today?
Thanks for a great question, Kelly. The vaccines are still in short supply, as we're all very aware of. Public health experts at the federal level through the CDC have made recommendations about the order that people should receive it in. And public health experts here in Wisconsin have been working closely with the Department of Health Services to make sure that we have a kind of framework for how we're rolling it out to the public. When you are in an eligible population, that means that we can offer you a vaccine here at UHS when it's available. Unfortunately, not everybody will be able to get that offered vaccine right away, just because supply is still so short.
Great, thank you. I also noticed your button. That is wonderful. Will people be able to get buttons when they get vaccinated?
Most assuredly will be able to get buttons and stickers. It is a time for celebration.
So then when can we expect that most employees would be vaccinated, and what about our students?
It is dependent on the supply that we are getting, which is kind of hard to predict. So we are estimating that it's probably going to be most employees will be vaccinated by summer, and that most of the students by the fall. We're hopeful that that is a conservative estimate and that it will go faster than that, but there is a possibility that it can always go slower than that.
Sure, of course. I think a question that we tend to get a lot, especially now that there are more people eligible per the state criteria, is how will people know when it's actually their turn? How will they know that they can make an appointment to get a vaccine?
Absolutely. Eligible employees will be notified through email. They'll get an email from UHS that will tell them to go into their My UHS account. And there is a tab on the left-hand side that says appointments, and you can choose your COVID-19 vaccine appointments. And the best part is it asks you if you're getting dose 1 or dose 2. And that does mean if you get dose 1 from us, you will get dose 2 from us. The federal government sends out to the states, and the states send out to the vaccinating entities both the first dose and the second dose to the same location.
Great, thank you, Dr. Cole. For people who aren't familiar, My UHS is the portal that UHS uses for all things medical on campus, and people can log in with that using their net ID and their password. So it's a good idea if you haven't done that yet or done that before to go ahead and give that a shot, and you'll be able to see everything that will be relevant to you once you can make that appointment.
It's a good idea to keep that information up to date.
Great reminder, thank you. So one thing I really, really appreciate is how eager so many people are on our campus to get their COVID-19 shots and to help keep themselves and the people they care about safe and healthy. So I'm really grateful that UHS can provide this the service and these vaccines to the campus community. I want to shift to Jake. So UW-Madison, obviously we are a very big and diverse place, and we have a wide variety of employees who serve a lot of different and important roles. And some of these employees are second and third shift employees, so they're not on campus during that 9 to 5 time period that a lot of us are used to. So can you speak to what UW-Madison is doing to ensure these employees are provided vaccines as well?
Thank you, Kelly. Yes, we are very aware that important parts of our workforce do work second and third shift. And while most of the vaccine appointments will be available during the traditional work hours, we will be offering extended hours to be sure that we can provide as much an opportunity for and conveniences for folks working both the second and third shifts. And we've done a similar thing around our testing availability as well. We also know that there's a variety of languages that staff have, and so we are prepared to support through translation of materials and interpreter services any issues that might come up there. So we be sure everybody understands and can ask their questions and get the answers they can as they make a decision or receive their vaccination. And then really what's also important is that our supervisors are flexible with their staff when they get the opportunity to get a vaccine, support them with that, and also support them with their follow-up appointments as well. So I think there's a variety of measures in place, and we'll continue to refine those.
Thanks a lot, Jake. Just want to remind those who are just joining us, we are having a town hall conversation today with Jake Baggett, Dr. Devlin Cole, and Ajay Sethi about vaccination here at UW-Madison. And below the video in the links listed, you'll find resources for captioning and American Sign Language interpretation. Jake, I want to stick with you for just a minute too. We've received a little bit of feedback here. We've received some questions from individuals who want to know, do they need to have a negative COVID-19 test before they can get vaccinated? So do you have to have proof of a negative test when you get to the NIC for your vaccine? And do you have to have a green badge in order to get into the vaccination site?
Thank you, Kelly. What's really important is that we remove as many barriers as possible for anybody who's attempting to get a vaccine. And so we've been very clear that you do not need to get tested before getting the vaccine. You also don't need to be in compliance with the Safer Badgers app. Matter of fact, there's actually a separate entrance at the NIC Center, at the Nicholas Center, so that you can go straight into that part of the building where the vaccination clinic are being held. And you don't need to show your Safer Badger app to enter that part of the space as well. Again, we're going to remove any barriers that folks might perceive or be worried about.
Thank you so much, Jake. And speaking of barriers, I think we'll get to this later, but our vaccines are provided at no cost to our campus community as well. So hopefully that eliminates any concern about financial barriers to vaccination. So my next question or set of questions here is for Professor Sethi. Professor Sethi, what would you say to people who aren't sure if they should get vaccinated or if they know other people who don't plan to get vaccinated?
Yeah, that's a great question, Kelly. Well, I mean, so of course, anyone who has questions specifically related to their personal health, they ought to start by talking to their healthcare provider. And for anyone not planning to get the vaccine, we have to respect their decision, but be available for them without judgment if they do have questions. And for people on the fence, I think it can be helpful to talk to family and friends who already got it and ask, what helped them decide to get the vaccine. Both my parents got the first doses a couple of weeks ago, and they would tell you that they got vaccinated because they wanted to feel more confident and safer when they leave their house. All three vaccines are excellent in preventing people from getting severely ill from COVID if they were to catch the virus. And we know the vaccines are working so far. For over a month now, there has been steep drops in hospitalizations and deaths among nursing home residents and older adults. And the vaccines are doing exactly what they're intended to do.
That's great, Ajay. Professor Sethi, I think there's been some maybe confusion in some news reports or just in some conversations around what the vaccines do or don't do. So as you mentioned, they prevent severe illness, but will they prevent infection?
Yeah, so we're not quite sure yet. We know from the vaccine trials that infection after vaccination is still possible, but being infected is not the same thing as being infectious. So there will be some impact on transmission, but how and how much are still being studied. And so that's why anyone who's vaccinated still needs to wear a mask and maintain physical distance. And people do often wonder about herd immunity, which is a term that is often misunderstood. Herd immunity means that we will no longer have any transmission of the virus, or at least not see any more outbreaks. And that's might be unlikely. What we will see more immediately as more people get vaccinated is fewer hospitalizations and deaths, and that's a great thing.
Thanks, Professor Sethi. Real quick, you mentioned this notion of infected versus infectiousness. Can you maybe explain a little bit more what you mean by that?
Yeah, so you can pick up the virus. It can sort of reside in your nose and your nasopharynx, but it may not be replicating at a level high enough that you begin to shed virus into your surrounding environment. And when that happens, that's when you become infectious. And it's possible after vaccination, but again, that's being studied. There's some data already to show that people who are vaccinated who become infected don't have those viral loads that people who are unvaccinated would have. So there's hope that this can help with transmission, but it's not going to be guaranteed.
Sure. So we might be in a situation where you can pick up the virus, but maybe not pass it on to other people. But we need to have a little bit more time to understand that better.
Yeah, that's right.
So I'd like to ask Dr. Cole a little bit more about how the vaccines actually work. Maybe you can tell us a little bit about the two vaccines that I think most of us have been familiar with to date, the Pfizer and Moderna vaccines.
Absolutely. So Pfizer and Moderna are both mRNA vaccines, which means that they're presenting instructions to your body, to your cells, to build one of the SARS-CoV-2 proteins. So we actually call it the coronavirus family because when you look at it under a microscope, they've got these proteins on the outside that look like a crown, so corona. And so we have actually taken the sequence of the spike proteins on the outside, and that's what's in these viruses, or sorry, that's what's in these vaccines. Just instructions to build this one protein. It is not a live vaccine. You cannot get COVID-19 from the vaccine. So it provides this instructions, your body builds these proteins, and then they tag them. They say, that is an enemy cell, and I'm going to destroy it. And it keeps a memory of it. And that memory is what enables you to fight. If you see the virus in the future, you can fight it off. So the Pfizer and the Moderna both need 2 doses. Pfizer is 21 days apart, and Moderna is 28 days apart. So if you get it, say on a Wednesday, 3 Wednesdays later, you'll get your Pfizer. 4 Wednesdays later, you'll get your Moderna. And your full protection, your full memory cell fighting comes about 2 weeks after that second vaccine, that second shot that you get. And I want to take a minute because I know people are a little unfamiliar with mRNA. This does not change your DNA. I'm going to say it again. It does not change your DNA. It also doesn't change your fertility. I know there's some concerns out there with fertility, and I know there's some concerns about pregnancy. There were lots and lots of women of childbearing age that were included in these studies. We have not seen any effect on their fertility. There were not people who were pregnant included in these studies, which is not to say that it's not safe for them. We just don't have the kinds of population level data that were ready to go when the CDC was and the FDA were looking at all of that information. Since then, we have vaccinated many pregnant people, and we have not seen adverse outcomes any different than the regular population, but it's still an important conversation to have with your personal doctor. The other conversation that you would want to have with your personal doctor is if you have a history of allergic reactions or other kind of bad outcomes to previous vaccines. That's a good time to have a conversation before you get it. It's not necessarily saying that you can't get it.
Thanks, Dr. Cole. We didn't talk about the fact that if you get the Pfizer vaccine on your first shot, you probably need to get the Pfizer vaccine on your second shot, right? You can't mix and match your vaccines.
Yeah, so the instructions that you're being given are very specific. It's kind of like a telephone number. Even if you had, 8 digits the same, if you have a couple of digits off for that full 10 digits, you're not going to be calling the same number. So in extreme circumstances, the CDC has approved a mixture of the both, but it's not recommended. We don't have the science for it. It's much better to get your second dose as the same brand, as well as in the same location, because that's where it's being sent.
Thank you so much. I love that analogy about the telephone number, Dr. Cole. It's great.
Yeah.
And I also think it's important to talk about the latest vaccine that has joined the armory here. I think we've talked a lot about Pfizer and Moderna the last few weeks because those were the first 2 vaccines that were authorized by the Food and Drug Administration for use during this pandemic. But we now have a 3rd vaccine, and that's a vaccine from Johnson & Johnson. Can you tell us a little bit more about that one?
Absolutely. We are all celebrating that we have more options on the table and more vaccines that we can give. So the Johnson & Johnson vaccine is actually somewhat similar, but it's called a viral vector vaccine. And so you can imagine a vector as holding on to that exact same instruction, the exact same mRNA that are being used in the Pfizer and the Moderna, but it's being shuttled to your cell inside a totally harmless virus. It's an adenovirus, which kind of causes the common cold, but they've deactivated it so you can't get a cold, and you still can't get COVID because there's no live COVID in the vaccine. There's just that instruction. So the instruction is on this little shuttle and it goes to your cells. And the benefit of having it inside the shuttle is that in addition to your body building that spike protein, labeling it as the enemy and keeping a memory of that, your body is also recognizing there is a virus here. And so you're actually recruiting lots of different kinds of fighter cells. So you get a very broad range of immune reactions. And so this one actually only needs 1 dose, which is great. It's a little bit easier. It's a little easier to store for us too, which is nice. And you still get that full protection after about 2 weeks. Again, does not affect your DNA whatsoever. It's safe and effective and has been tested all around the world.
Thank you so much.
I should also mention, sorry, Kelly, I don't want to cut you off.
Okay.
I'm using this word effective. And I know that you're going to be seeing lots of different numbers comparing Moderna and Pfizer, 60, 80, 95. The trouble with comparing Johnson & Johnson with Pfizer and Moderna is that they were not tested at the same times or in the same locations. And as we all know from reading the news, there are tons of different variants out there. So it's a little unfair, and it's not, as we would like to say, epidemiologically sound to compare the two. So all 3 of these have been given emergency use authorization by the FDA, and they are all equivalent. There is no, you should not be holding out for one or the other. The FDA is treating them all equally.
Thank you so much, Dr. Cole. So I was actually going to ask you that, so you preempted my question.
You're reading your mind, Kelly.
Perfect. We are seeing that potentially the link for captioning isn't working. And I was going to say, to anybody who has joined us since, thank you for being here. I think we're going to swap out the link there, and there should be a transcript button so that you should be able to click on that and see the full transcript. But we are working on getting that fixed as soon as possible for those in the audience who are relying on that captioning. So apologies for the little bit of technical difficulty there. Jake, I want to come back to you. I think I mentioned this already, but just to reiterate, students and employees won't have to pay anything for the vaccine, right? And what about taking time off of work? Do they need to take a day off to get their vaccine? Do they have to take an hour or two off of their shift? And what about any time for recovering from side effects they might have?
So first of all, I really appreciate the institution has committed resources and time to set up and administer these clinics. And it's great that we can do that without having to worry about charging for those services. And that does allow us to be much more efficient with our time and focus on the real important work of getting vaccine into individuals who are ready to do that. So no cost associated at all. And then there's information available on the website. There's a link there on a slide that I think we'll share with you as well through HR that outlines the leave options. But in short, supervisors should be able to provide time for people to go and get their vaccine when that becomes available for them. In terms of side effects, anybody who does experience side effects, and some do, they're short-lived. If you do experience them, you would have sick leave available to you to cover you for that period of time as well.
Is my audio back on here? Great. All right, thank you, Jake. I just want to clarify that the interpretation and captioning are definitely happening. So if you go to those links, you will find them. You just have to click on the transcript button, which is not normally something you have to do. And I'm told the link is updated and confirmed. So thanks for bearing with us. So Professor Sethi, I'd like to come back to you because as we've discussed, COVID-19 vaccines make it harder for us to catch and pass on the virus. But more importantly, and I think you emphasized this well earlier, they prevent us from getting really sick, and they've helped prevent deaths from COVID-19 too among the individuals who've been vaccinated already. But something that we're hearing a lot about are these new versions or variants of COVID-19. Do we have any reason to think that the vaccines won't work on those variants? Is it still worthwhile to get vaccinated?
Yeah, that's a great question and something we're all talking about a lot. Yes, luckily right now, all of the vaccines will prevent serious illness caused by the new variants. And that's why you might have heard sort of the race against the new variants. The faster we can vaccinate individuals, the less important these new variants sort of become. And manufacturers are working on updating the vaccines should the need arise. If we see boosters in the future, the boosters will contain sort of the latest version of the vaccine to help protect us against COVID. And in Madison and Dane County, about 5% of the samples that are collected from people who are test positive for COVID are sent to our campus for sequencing, actually to the laboratories run by Professors Tom Friedrich and Dave O'Connor. And this is how the UK variant, what we have called the B117 variant, was identified in Dane County recently. And unfortunately, we can expect newer variants to continue to crop up, as long as we allow high-level spread here and around the country. And we certainly want to avoid that with masks and with distancing, what everybody's heard about for so long.
Would we expect that as more people become vaccinated and we might see some tapering off of transmission, that might also limit some of the opportunity for the virus to generate new variants?
Definitely. If the virus is not spreading, it doesn't have a chance to evolve, and new strains don't have a chance to become epidemic again. So that's why mitigation and vaccination in synergy is the right combination to really get out of this pandemic. vaccination alone will always cause us to maybe just chase the next new strain, but we can really if we cut down cases, we cut down the chance of new variants.
It's a really good reason for us to continue to wear masks and physically distance until more of us can be vaccinated, right? I think we'll talk a little bit about, what can we do once we're vaccinated. But first, I'd like to go back to Dr. Cole. I think another question we tend to get a lot are questions about side effects. What will happen to me personally in sort of the immediate aftermath after I get a vaccine? So what side effects might people expect? And is it okay to have these side effects?
Yes, this is a great question, one that I see a lot. This vaccine has been labeled with a fancy word called reactogenic, which means among the vaccines that you might come in contact with, this one is a little bit more likely to cause some side effects. They are totally normal. They are actually expected because it means that your body is doing a good job. It means that it's reacting and fighting off the proteins that we have asked it to build so that it can remember and fight the virus in the future. Things that you should be expecting, about 3 out of 4 people will expect arm soreness. So arm soreness, especially right at the vaccine site, very common. About 1 in 3 people feel really tired afterwards. 1 in 3 people maybe will have a headache. Full body aches and pains, really only like 20%, 1 in 5 people. And fevers or chills, that's more like 10 to 15% of people. So I know that those are oftentimes the stories that we hear the most. Oh man, I had a fever afterwards. But it may be more than, say, the yearly flu shot, but it's actually really only about 1 in 10 people. Some people are saying that they find that they had stronger reactions after the second dose. It could be because you have some good memory cells that you've created and your body is really attacking that virus. Some people were more affected by the first dose, so it's definitely an individual experience. But it is a normal sign that your body's immune response is kicking in. And it's totally okay when you're feeling achy and you've got a sore arm to take ibuprofen, Advil, or acetaminophen, which is Tylenol. Totally okay to be treating those symptoms. We don't recommend that you pre-medicate. We want your body to have that initial inflammatory reaction. That's actually part of how it forms that memory. And interestingly enough, caffeine, especially coffee, can sometimes stop that inflammatory reaction. So try to drink caffeine-free beverages around the time of your vaccine as well, just so that you can maximize the immune response, that good memory cell creation as you're getting your vaccine.
And Dr. Cole, for people who maybe are having a hard time keeping notes on this, they'll get information when they get their vaccine, correct? They won't just be at home without any tips or suggestions.
There will not be a test at the end of this town hall. You will, in fact, be given a handout. And you can always go and look in your My UHS to find out what kind of vaccine you got and when you got it, which can help you then schedule your second dose.
Sure. So side effects are something that happen to some people. They are normal and they're okay. What should somebody do if they have any reactions that they're concerned about?
That's a great question. Definitely, please call in to your primary care provider and get help if you need it. If you are having a more extreme reaction, if you think that you may be having an allergic reaction, if you're having trouble breathing, if you're having changes in your skin color, definitely consider going to the emergency department. For helpfulness about tracking those kinds of things, there's 2 different methods that the government's using right now. There is a vSafe application that's on your phone that basically sends you a little text message every day, and you answer a couple of quick questions and tell them what kind of side effects you're having. So I'm telling you 75% of people have arm soreness. That's because the vSafe app recorded that in the middle of January, and the CDC was able to publish that information. So it's super helpful. But if you're having a more severe reaction, you can actually report that in VAERS, VAERS, the Vaccine Adverse Events Reporting System. not the easiest acronym to remember, but if you put in adverse events or vaccine adverse events, you should be directed to that website. And that's a great place to keep track of those as well. The CDC does have physicians that man that portal and can reach out and give you help as well.
Thanks so much, Dr. Cole. And then I just ask this one really quickly, but side effects, the normal side effects, do they happen right away or is there a little bit of a delay? What should people expect?
So I've actually been in the clinic as people are getting their shots, and most of the time people are amazed at how little they feel. I didn't feel anything when I got both of my shots. This is a really smooth administering shot. So you may not actually feel soreness and achiness and fatigue for maybe 8, 10, even 12 hours. So you can sometimes use that to help plan your day if you know that you may not feel symptoms for a few hours. You can take an Advil before going to bed and hopefully wake up feeling better the next day.
Thank you. And one more until we before we transition back over to Jake. But how long do we expect these vaccines to last? So if I got a shot this month and I got my full vaccination, how long will I be protected against COVID-19?
That is a really good question. And it's one that doesn't have an easy and straightforward answer. It's an ongoing process. So it looks like the early studies that are coming in are showing at least 4 months of protection, which is good because the estimates of actually having protection from having gotten COVID are about 3 months, about 90 days. So it looks like it may be a little longer, and we could be learning more as we go on and hopefully get to extend that. It could also be a situation similar to swine flu, H1N1, where they just actually added that vaccine to the yearly flu shot to give everybody a little booster. So there's lots of different options that we may see going forward.
Great, thank you so much. Speaking of options, Jake, are we going to require, or is anybody required right now to get the vaccine?
Thank you, Kelly. That's a question that frequently comes up, and we want to be very clear that this is not going to be a requirement. The university is not putting that in place, but we really want to encourage anybody who is able to get vaccinated, and not only protect themselves but those around, and really support that. So we want to answer any questions that you might have and make it as convenient as possible, and make you comfortable in making that decision for yourself. But there won't be a requirement to receive this vaccine.
And Jake, if somebody is offered vaccine, let's say, at the end of March, and they decide that maybe waiting is best for them for whatever their circumstances are, will they be able to then get the vaccine later?
Absolutely. I mean, and you have the choice about when you're going to receive that. When your population becomes eligible to receive the vaccine and the supply is available, you will be given that opportunity. But you can, if you choose not to do it now, you can always come back and do that later. Absolutely. And some people want to think about that decision, and that's certainly their choice.
Thanks so much, Jake. I think something that people want to know too is, how long do we need to keep physically distancing and wearing masks after we get vaccinated?
And, adding really to what Dr. Cole and Professor Sethi were talking about, we're still learning a lot about that. So really what we need to do is the things that we've all been doing and doing very well, which is continue to wear face coverings, to support that physical distancing that we're all very accustomed to, and then take those precautions to keep from spreading unintentionally spreading the vaccine among other folks. So the things that you've been doing really well that's contributed to the low rates that we're experiencing, we'll need to continue to support that through this time until higher levels of vaccination are established.
Yeah, thanks so much, Jake. Something that I tend to think about a lot with these vaccines is once you're vaccinated, you are protected personally, but may still be capable of transmitting virus, as we've discussed. And until more people around us are vaccinated, we need to do our part to protect those people from the virus. So that's how I tend to think about it. And they're also protected for us because, as we know, some people can still become infected and potentially infectious with COVID-19 despite vaccination, though they are really effective. And again, prevent that really severe illness and hospitalization, and have definitely played a role in reducing deaths from COVID-19.
Yeah, I would add to that we don't have an approved vaccination for children yet. So until that becomes available, we'll also need to take care with that population as well. So that's another reason to consider getting the vaccine when it becomes available.
It's a really important point, Jake. Thank you. Professor Sethi, I want to ask you about vaccine safety. I know we've talked about it a little bit more, but hopefully we can dig in a little bit. Can we trust these vaccines? Or maybe why should we trust these vaccines? And then maybe you can talk about a little bit about the UW-Madison connection to mRNA vaccines like Moderna and Pfizer.
Yeah, I'm glad you brought that up, Kelly. The science behind the vaccines goes way back. And actually, Dr. John Wolfe and his colleagues at the Weizmann Center here on campus did the original proof of concept study in 1990, showing how RNA could be used to make vaccines in the future. And here we are 30 years later, after a lot more science was carried out, of course. And RNA vaccines are giving us hope and a way to get out of this pandemic. Sadly, Dr. Wolfe passed away last year after a long battle with cancer. But there's a tribute that you can see online that's written by his family and colleagues at the School of Medicine and Public Health, which is quite nice. I think it's important for people in Wisconsin to know about our campus's role in the vaccine. For me, it's a source of pride. I often think for HIV treatment, you can't have HIV treatment without Howard Temin's discovery of reverse transcriptase. And here's another example. Without Dr. John Wolfe, we wouldn't necessarily have RNA vaccines today. Now, Kelly, you also mentioned about safety and trust. And so far, 80 million shots have been given in the US and about 250 million shots have been given worldwide. And the rollout is confirming what the clinical studies have showed, that this is a very safe vaccine. All of them are very safe. And as Dr. Cole mentioned, the CDC tracks the safety of the vaccines and the symptoms that may be appearing with the vaccine. And so far, the only ones, as she described, are the ones typical of getting a vaccine in general. Regarding trust, I'd say, confidence in the vaccine definitely has been growing. And of course, there are people who remain skeptical. And, it doesn't help that so much misinformation about the vaccines floats around out there. Unfortunately, we just live in a world where, people fabricate information, spread it to unsuspecting people, with the goals to deceive them and undermine anything successful that our government is a part of. And that's just really unfortunate. But I believe if we have, fruitful conversations between people, we can sort of overcome that epidemic of misinformation.
Thanks, Professor Sethi. I know that you teach classes about this, and you talk pretty often about talking to people you trust about vaccines in this case, and so I suppose you would recommend that, right? Going to other people that you trust, whether that's your physician or a colleague who might have been vaccinated, and asking some questions.
Yeah, it's more than that. I say, it's always important to have trusted sources of information and people who you can talk to without any judgment. I have a rule of thumb. I try to minimize the number of people I talk to who begin sentences with "you should." It's nice if somebody actually wants to listen to my concerns and have an actual conversation rather than getting a lecture. And I think we all know those individuals in our lives, and I think that's important. And as we've all said before, if you have questions, you can always go to your healthcare provider, related to this vaccine or anything that's health related.
Thanks so much, Professor Sethi. And I'm very glad that you brought up Dr. Wolfe. As the Director of Research Communications and a science writer, I'm always looking for opportunities to talk about the importance of basic science. I think we often, when we think about research, we think about, what does this mean for society? And this was research that was started 20 years ago, and at that point had no idea that it might lead down this path. And so especially at a research institution like ours, I think it's important to remember that sometimes these paths lead us to unexpected destinations. Professor Sethi, I have another one for you, because this is a question I think that is on everybody's mind. But vaccines are available, we're getting them out as quickly as possible. So what does that mean for when I can hug my grandparents again? Will the vaccines allow us to return to pandemic life or pre-pandemic life or something like it? And when might we expect that to happen?
Yeah, that's a great question and a common one. And I'd say that anybody who gets vaccinated should feel confident that they can personally avoid serious illness if they were to catch the virus. The vaccines are just highly efficacious at preventing hospitalizations and deaths. So if you are vaccinated, or your parents are or your grandparents are vaccinated, actually both of you, all of you are vaccinated, and it's been 2 weeks after the second dose for everyone, the studies continue to show that immunity is maintained after vaccination so far, and you can then hug your grandparents. The vaccines, won't guarantee zero risk, but you should certainly feel far more joy than fear after that hug. And I think that's really important right now. The question becomes, how many unvaccinated people did you come across on your way to visiting your grandparents? Did you drive or did you board a flight? Do they live in Florida, where we know there's many cases of the UK variant that are circulating? The vaccines don't necessarily prevent you from picking up the virus and passing it on to someone else, as we've talked about multiple times already. So you will have to, travel cautiously with all the same precautions like masking and distancing. But those are social norms right now anyway. So, taking that trip is you'll expect to see things and to do things that we're already doing. You just don't want to become a contributor to COVID spread or unnecessarily, test the immunity, your immunity or your grandparents' immunity after getting the vaccine. But if either of you catches the virus, you can feel very confident that that hug won't lead anyone to go to the hospital. As a society, we won't get to pre-pandemic life in 2021, but vaccinated individuals can certainly feel more secure, than unvaccinated people.
Thank you so much, Professor Sethi. That means a lot. I have not seen my family in more than a year. They don't live here in Wisconsin, and so I am looking forward to the day that I get to go and see them. But in the meantime, until more people are protected, I'll continue being safe and practicing all of those public health measures that we've been reminded to follow. Dr. Cole, something else people would like to know, do they have to keep getting tested for COVID-19 after vaccination?
This is a popular question, especially on our campus. So as Dr. Sethi was explaining, this doesn't eliminate your risk entirely. If we're using the numbers from the Pfizer and Moderna, it's about 95% less risk. But there are definitely still some people who get fully vaccinated and still do get COVID-19, especially with different variants flowing around. So if you are having symptoms, please get tested. Even if you have been vaccinated, please get tested. Currently, because we don't know exactly how the vaccine is faring in the general public, it's still recommended that you follow the regular testing procedures, whatever community that you're a part of. It could be possible in the future that we see that relax a little bit. Policy changes may go into effect as more people are getting vaccinated and we get closer to that herd immunity. But currently, definitely still get tested.
Thank you so much, Dr. Cole. Jake, this is maybe not necessarily directly relevant to our campus community, but I think a lot of us are very familiar with the Wisconsin idea and the importance of the service that the university provides to the broader community. Could you maybe talk about UHS's efforts to help provide vaccines to our neighbors in Dane County and our plans to help vaccinate K-12 teachers?
Absolutely. And UHS and the university have really been intentional and very active partners in the collaboration among the vaccinators and the public health of Madison-Dane County Department as we to get the vaccine out to the eligible populations as quickly as possible. And we have certainly done our part here on campus, and we're actively going to be engaging and supporting the effort to vaccinate the K-12 population here, teacher population in the coming weeks as soon as that vaccine is available. And we'll continue to do that. We know that the more we can get our entire community vaccinated, the safer it is for all of us, whether here on campus or in our community. And so we're definitely committed to supporting that, and look forward to more opportunities. And we know that as we move through these phases, the sooner we get phases done, we can, as an entire community, move forward onto the next eligible populations.
Thanks so much, Jake. Dr. Cole, we talked about your button already, your UHS vaccination button. Since you've been vaccinated, can you talk about what that was like for you?
Absolutely. So the day that I got vaccinated, obviously, I was personally thrilled. I've been following the science on this for a really long time, and it was absolutely incredible to see it real in person. I was counting down the days. And there was a real relief as well, that feeling of protection and that feeling of moving forward in a really tangible way. But I also want to acknowledge that there was a part of me that felt a little guilty. And I've heard this a lot in people that are now in eligible populations who are able to self-isolate a little bit more. There's an element of acknowledging that privilege and wondering, maybe I should wait, maybe I should delay. And I think it's really important to reflect, as I said in the beginning, there are public health experts at the CDC and public health experts here in Wisconsin that have gone through many iterations of the ethics of what's involved, of who should get it and when. And there is no magic formula. There is no perfect right time. So if you are in a population that has become eligible, I highly recommend that you go and get it as soon as possible. And it sounds a little silly, but in a couple of months, there's a very real possibility that we will have a considerable amount of vaccine on our hands, which would be amazing. But it's actually going to flip the problem from one of scarcity to one of how do we find all of the people that are really hard to reach, really hard to get to, and really hard to help get them the vaccine that they need. And the more people that we can have right now vaccinated, the better. So I know it's a long and tedious wait to actually get that email from UHS saying that you can get it, but please feel happy, feel relieved, feel thrilled like I did. There may be some tears that are shed. Our nurses are prepared. They are just as happy as you are. But please don't feel guilty. Please definitely come in and get your shot when you can, because we're all in this together. And by the time we get to you, the ethics have been done. The boxes have been checked. Your number has come up, and it's a good thing. Come and get vaccinated.
Thank you so much, Dr. Cole. I think that's a really important reminder, and probably good for some of us to hear who might feel like we want to defer to other people to get vaccinated. But it's important that as many of us get vaccinated as quickly as possible, right, during this pandemic.
Our rallying cry is shots in arms, shots in arms, shots in arms, shots in arms. So
I can attest. I've heard this at UHS. And just again to remind people that cost should not be a barrier, because these vaccines are available for free to everybody in the campus community. Professor Sethi, can you maybe provide some advice to people who might be hearing from others they know that those their colleagues, their friends, their loved ones might be nervous about getting the vaccine? What would you say to somebody who approached you that way? How would you talk to them as a trusted source about what to do, and maybe remind us again about herd immunity and why that's important?
Yeah, I'll say that we have people we trust who we can go to for information. They come to us, and I think the first thing of a good relationship is that you're talking to someone who will listen to you. And so I think it's important that you listen to somebody who may be on the fence, who may be nervous. Find out sort of the reasons why. If you just start, again, lecturing about the importance of getting the vaccine, you're not actually listening to why they may be on the fence. They may be very specific. You can sort of point them in the direction of, correct information or other things to help change their mind. And I think the important is that our goal is not to change somebody's mind. They need to change their own mind. And so you want to point people in the right direction, but you don't want to push them there because that's not how we would want to be treated if we were in that position. The herd immunity, thing is important. The more people who get vaccinated, the more protection our entire community has, towards, moving past this pandemic, or at least moving towards a point in our lives where we can actually manage the number of COVID cases that occur, and minimize deaths, because the most vulnerable will be vaccinated. And I think if people, if that comes up in conversation, I think that's important. It's been a tough year. I think by getting vaccinated, you're doing your part to actually improving the entire community's health, not just your own health. And that's something I think can be very appealing when you really think about it, and hopefully be motivating for people.
Those are very good points, Professor Sethi. Thank you. And then I have, this is probably my last question for all of you, my last overall question, because I know we're running up here on about 10 minutes. But Dr. Cole, just because we've heard this a couple of times, I know you raised this earlier, but I want to go ahead and reemphasize it. Can you get COVID-19 from your vaccine? And can being vaccinated cause you to test positive on a COVID-19 test?
Those are two very good questions. So the answer to the first question, can you get COVID-19 from your vaccine, is no. It is no, period. There is no physical way. It is not possible. No, you cannot. As for testing positive, no, you also cannot test positive. And that's really interesting. Why? It's because we're just providing an instruction manual on how to build that protein. So it's not the same kind of antigen. That's the fancy word for all of the different kind of foreign proteins that can be in your bloodstream when we're doing those different tests. So no, you shouldn't expect to test positive. People that are looking for verification that they have had the vaccine and it's been effective, you could theoretically see some antibody. I know sometimes people who are giving blood at the Red Cross say that they do antibody testing. So that may be the response that you're seeing, but you're not actually going to test positive for COVID. If you do test positive for COVID-19 and you've been vaccinated, it means that you have COVID-19 and you are one of the unfortunate few that has had this happen to you. So you need to do exactly the same thing that you would if you hadn't had a vaccine, which is isolate for 10 days. And know that your body is now giving you even more protection against COVID.
Thank you so much for that clarification, Dr. Cole. I know that that question does sometimes come up, and it is important to remember that vaccines are safe and they're really effective, but it is still possible for some people to pick up COVID-19, to catch COVID-19, and potentially present as a risk to other people who aren't vaccinated. Mm-hmm. Well, all of you have been really, really great, and I am so grateful to you for being a part of the panel, for answering our questions. I know that UHS, the university, have been working really hard to get vaccines out to as many of our eligible employees and students as possible, and to keep as much information flowing and out to the community as possible. To wrap things up, I'd like to invite each of you to leave the audience with just a couple of final words. Jake, I'll start with you if you have anything you'd like to close up with.
Thank you. First of all, I want to thank all of you on the campus community, in particular those of you who are tuning into this broadcast, for being so diligent about following the health protocols and the measures that we put in place, to participating in the testing protocols. We know that's making a difference. And we're very excited to be moving into this phase of our fight against the pandemic. We just want to thank you in advance for your patience as we move forward through this process. I want you to have confidence that UHS is ready and excited so that when the supply becomes even more available, that we respond efficiently and quickly so that you can get vaccinated as quickly as possible. So look for those messages from UHS. And again, thank you for doing everything that you're doing to help us fight this pandemic.
Absolutely, Jake. Thanks for that. How about Dr. Cole? What would you like to leave the audience with today?
My message is that this vaccine is safe and it works, which is great news. It's safe and it works, but definitely still keep in mind that you have to still mask, you have to still physically distance, keep washing your hands. especially when you're in spaces where you don't know everyone's vaccination status. We can see the light at the end of the tunnel. We know what we need to do to get there. And luckily, we now have a safe tool that works to help us bring about the end much faster.
Thank you so much, Dr. Cole. And Professor Sethi, what do you have for us?
Yeah, thanks, Kelly. I'll say for people listening, when it's your turn to get the vaccine, if you feel like you're on the fence about getting the shot, consider talking to friends and family who did get the vaccine or will be getting it. Talk to people you trust, people who won't judge you, and have a conversation. And likewise, if you intend to get the shot or already have, be that trusted resource for a friend and family member, who isn't sure about getting it. There's a lot of misinformation out there, and it's really just a shame when someone makes a misguided decision as important as this one. The vaccines are excellent at preventing the worst outcomes of COVID. And I think it will help all of us feel more normal once vaccinated.
I think that's really important. We've been doing this for almost a year now. It's been a lot of conversations about, reminiscing about a year ago. So I personally have a lot more hope for what's coming very imminently too. So thank all of you for being here and sharing your knowledge with us. I think we're running up here on time. So again, thank you so much for being here. Thanks to the audience for spending your lunch hour with us. We're going to do this again on March 17th, also at noon. So encourage others who couldn't make this one to participate. And, we might have more information to share by then as well. And just so that everyone knows, this video will remain available. It'll be active on the YouTube page where you are now, and we're also going to be posting it to the COVID response website, which is also where you will be able to find lots of vaccine information. I know we're working on updating all of our vaccine information now, and hope to have a lot of more of our materials translated for all of our community. Please do continue to monitor the website for the latest information on the FAQs. Keep an eye on your inbox, especially for that golden email from UHS that says you are invited to make a vaccine appointment. Also a reminder that a lot of this information is shared in weekly updates from the Chancellor, so please do check your inboxes for those. Your HR representatives should be a good resource for you if you have more questions, and we're working with them pretty regularly to share information and also, this dialogue, hearing your concerns and questions as well. So please keep doing everything you're doing. We want to make sure that everybody stays safe and protected and healthy. Vaccines are just, the latest and best tool for us to do that. And further, if you have any more questions, you can send those to your divisional human resources representative. You can email the COVID response email. You can email UHS. We're here if you need anything. So thank you so much for joining us.